Hey, good morning, you guys. Time for your health check. Look, I know that a lot of you all are sort of navigating this new COVID-19 world, as are we. All elective surgeries, as you all know by now, have been postponed, and that is big news for people who are either cancer survivors or patients. So to answer some of your questions, I wanted to chat with Jeff Falis. He's the Executive Vice President of the American Cancer Society. Jeff, first of all, postponing some of these elective procedures in the middle of treatment or when someone's about to start treatment can be really frightening for these patients, these people. What are you suggesting or recommending to them right now?
Well, absolutely. And, unfortunately, cancer doesn't stop and neither can we. But unfortunately, with the current environment, we're having people get some kind of treatments and some surgeries that are being deferred. But we want to be there for those cancer patients to answer any of those questions. And that's why our call center, our National Cancer Information Center, remains open 24/7, 365. We've got oncology nurses and cancer experts on call 24/7 to answer those critical questions.
And I'm sure, Jeff, that some of the questions that you're receiving might be, well, can I still get a mammogram? Or I really need my colonoscopy, or about HPV vaccines. Does that mean all of that is off the table right now?
It doesn't mean it's all off the table, but you need to anticipate maybe some delays. And it just really depends. And you need to reach out to your healthcare provider to really try to understand what those options are.
To that end, a lot of people have reached out to me to say, I am either in remission or I'm a cancer patient, from years ago. Am I at high risk? Have you guys been getting those kind of questions? And if so, what are you suggesting? Do they go to a primary care physician or do they go to their oncologist?
Well, first off, you need to, cancer patients, anybody with a compromised immune system is going to be at higher risk. And cancer patients are definitely in that category. And so, social distancing, what we're doing, stay at home, limit your exposure, keep distance, are all things that we all need to be doing. But those cancer patients and survivors critically need to do. So call your physician, call your oncologist. They can walk you through what's next.
Certainly, especially if you're seeing symptoms. Jeff Falis, thank you so much for your time. We're going to head over to Greg, who's in the Weather Center with a check of the forecast now. Greg.